People attack kind of American health insurance from a lot of different angles, and I find that some of these angles are very convincing until you start to dig into them, and then they become a little bit less convincing. So, for instance, I think we kind of want to tie life expectancy, for instance, into healthcare spending or healthcare funding in the United States, and then compare that to spending or life expectancy in other parts of the world. But in the United States, we have issues related to suicidality or violent crime or firearms, for instance, that also directly curb life expectancy, especially by killing some of our youngest people. Last I heard, under the age of from 18 and below, your most likely way of dying is due to firearm violence. I don't know if changing how we spend money on healthcare would necessarily cut into things like that. I'm not really convinced they would. So I'm not sure how much the life expectancy thing would be helped when we look at, allocating resources differently in terms of healthcare. Same thing when it comes to like preventative medicine or preventative healthcare. One of the biggest things that pushes a lot of Americans into an unhealthy place in life, especially as they get older, is obesity. And that's another thing where I'm not fully convinced that simply moving some of our money around with how we spend in the United States on healthcare would actually do anything to alleviate the massive obesity stuff. When it comes to hospitals being incentivized to give, bad health care or to do routine treatments, I think that it's kind of hard to speak about hospitals as being like a fully rational market where consumers can price shop and have a ton of different information available to them, typically because at the point of consumption of healthcare, a lot of the time we don't really have the luxury of making those choices for a variety of reasons. In an emergency situation, obviously, you don't have time to make phone calls to different hospitals. There might not be any other hospitals around that offer what you in particular need. If a person has like a heart emergency or some kind of stroke, I doubt that somebody's going to be calling around to see who has the best stroke doctor or the best cardiologist or whatever. You're probably just going to whatever's closest, and then those types of specialists are in short supply in general, so I doubt that you have 10 different heart specialized hospitals even in your area regardless. So I don't know if moving health insurance to a private market or getting rid of Medicare and Medicaid would do much to alleviate or would do much to help us shop for healthcare. It just doesn't seem like a very efficient market to shop in. I know that when we talk about old people and we talk about their wealth and we say, well, maybe these people should be able to spend more on healthcare, there's a whole other conversation. But I think for the United States, the most common way that we have our wealth, especially in old age, is tied up in our homes. And even if it was on paper good economic policy, which I'm not fully convinced it is, I think the idea of grandma or grandpa being forced to sell their house when they have a major operation is probably something that would be so catastrophically bad politically that that system would just be completely unbearable. I'm kind of a fan of like means testing in some ways. It's my inner free market, libertarian, whatever guy. And I shouldn't say libertarian. I should say neoliberal is the one that they say. But the issue when we talk about like means testing here, like we're talking about means testing people at different levels of healthcare and giving them a minimum spending voucher that they would be able to spend on healthcare and covering them in the event of like catastrophic events and making sure like at all points in their life they're like qualified for this coverage, and it has to slope off so that when you gain more money it doesn't all go away, so you're not disincentivized to earn more money. I feel like at the end of the day, even if you're a fan of means testing because you think it'll save money, that whatever system we put in place there is going to be so absurdly complicated. You've either reinvented some form of Medicaid or Medicare, or it becomes more bureaucratic and less efficient than if we were to just do Medicaid or Medicare.